As defined by the World Health Organization, a vaccine is a biological preparation containing an agent that resembles a disease-causing microorganism. This improves immunity to a particular disease by stimulating the body's immune system to recognize the agent as foreign, which results to antibody formation. Through vaccines, etiologic agents of diseases are easily recognized and destroyed by the immunized person's immune system. In May 1974, the 27th World Health Assembly resolved to build on the success of the Smallpox Eradication Program and establish the Expanded Program on Immunization, or EPI, to ensure that all children in all countries benefited from life-saving vaccines. This program remains committed to its goal of universal access to all relevant vaccines for all at risk. Immunization is a proven tool for controlling and even eradicating infectious diseases. The first diseases targeted by the EPI were diphtheria, whooping cough, tetanus, measles, poliomyelitis, and tuberculosis. In accordance to the international movement, the Department of Health established the EPI in the Philippines during the year 1976 to ensure that infants or children and mothers have access to routinely recommended infant and childhood vaccines. To further strengthen and regulate the said program, Republic Act No. 10152, Mandatory Infants and Children Health Immunization Act of 2011, signed by President Benigno Aquino III in July 26, 2010, was approved and passed by the Congress. This was an act to declare that basic immunization should be a mandatory basic service to infants and children. Statistical data from a sample population in a rural community implicated that the compliance was low. The graph shows that before the mandate, from year 2000 to 2009, less children were able to avail the vaccines and complete the government's program. As a response, strategies were devised to improve adherence to the program. In 2004, the Department of Health introduced Reaching Every Barangay, or REB strategy, which aimed to improve the access to routine immunization and reduce dropouts in the program. This is part of the action plan the DOH utilized to ensure that each child in the Philippines is vaccinated. Furthermore, Supplemental Immunization Activity, or SIA strategy, was also introduced, which targets children who did not develop sufficient immunity. Another part of the action plan implemented is in line with a child's education, wherein a non-fully immunized child was not allowed to enter preschool as a regulatory move by the department to ensure the eradication of vaccine-preventable diseases. Because of the active campaign on the vaccination and the regulation of the said program, the number of cases of vaccine-preventable diseases have decreased in the recent years and the compliance rate of the community has improved. It was recently reported that only about 60% of Filipino children are getting scheduled vaccines, which was below the Health Department's annual vaccination target of around 85%. There were also recently reported measles cases that caused death to children, which could be prevented by routine immunization. According to WHO, there are over 17,200 reported measles cases in the Philippines in 2018. This is a 367% increase compared to last year. In October this year, the DOH Bicol office reported a 300% increase in measles cases in the region. DOH Bicol has monitored 239 cases from January to September, which includes 6 deaths. Those who died were not vaccinated. It had led to more parents refusing to avail the government's various vaccination program as reported by the DOH. In the report given, the Dengvaxia issue is discouraging parents from availing other government programs for their children and is one of the reasons for the spike in measles cases. When the bill was passed, there was a positive impact on the compliance to the said program, but because of the recent controversy, it was now again significantly decreasing. Out of the prevailing situation or conditions cited, possible recommendations would be to explore awareness, attitude, and beliefs of the general public regarding their perception on EPI. This can be done through advocacy campaign by mass media, either in television or in print. By providing them substantial information about the program, their misconceptions on the issue will be corrected. As frontliners of the implementation, the DOH and Department of Education must work collaboratively by designing a well-crafted mechanism to motivate all beneficiaries of the program. On the regulatory level, it would be beneficial to pass another law or revise the existing Act on Immunization. Revisions would include that children in the school-bearing age should have an up-to-date vaccinations in order to attend school. It will be the responsibility of parents and caregivers to provide proof of immunization for students to the local health unit. Under this law, students can be suspended from school if they do not have all the required vaccinations for the diseases under the EPI program. Parents and caregivers would be asked to verify and check their child's immunization status to ensure that all vaccines were given in order to enter preschool or continue their school. Vaccines are proven to be safe and effective for reducing the risk of getting sick from a variety of disease. It can save lives and protect everyone from vaccine-preventable diseases which can cause serious complications and in some instances, death. That is why it is encouraged to receive all the recommended vaccines by each member of the community.